Hi there, how are you?
I'm good. How are you, Candace?
Doing well. Thank you so much for joining me. I appreciate it.
Thanks for having me.
Of course. So, what causes diabetes?
What causes diabetes? Well, one of the things that doesn't cause it, or it's a misperception, is that too much sugar. It doesn't help, but really what causes diabetes is the inability to use the insulin your body's producing correctly, and or not producing insulin at all. There's two types of diabetes. There's type 1 diabetes and there's type 2 diabetes. Type 1 diabetes used to be called childhood, but it's no longer classified that way because age can vary dramatically. But it's an autoimmune disease with genetic component. And type 2 diabetes is really what we're here to talk about today, because that's 90% of patients with diabetes have type 2 diabetes.
And what factors put someone at risk for diabetes?
There's controllable factors and uncontrollable factors that put people at risk for diabetes. Age is uncontrollable, but as we get older, 45 would be a particular age where it's kind of a marker for starting to increase your risk factor for diabetes. Race, if you're of Hispanic, African American, or American Indian descent, you're going to have a higher propensity for incurring the disease in your lifetime. Also, having family members, genetic component, with having lost 2 brothers and a dad to this disease, it doubles my risk factor. Will double anyone's risk factor if they have a genetic component. But the one thing we can control is being diagnosed earlier. Men, unfortunately, guys, get to the doctor, get diagnosed. They don't get to the doctor in time, so they get diagnosed later than women do. Also, having high blood pressure. So reduce the salt or add high blood pressure medication. It will help reduce your risk for developing diabetes. And then the 2 most common controllable factors are your activity level, and the more active we are, it can reduce it 30%. So it's definitely worth leaving the car keys on the counter and taking a walk or taking the bike, using the stairs instead of the elevator. The more active we are, we'll definitely reduce our by 30%. So that's a significant reduction. And being overweight. So being overweight, if we can lose 7% of our, can dramatically reduce it. So if someone's 200 pounds, that would be the loss of 15 pounds. Just 15 pounds can make a difference on reducing your risk factor for diabetes and cardiovascular outcomes too.
And like you, I have a huge family history of diabetes. Is there anything that people like us can do to help prevent it?
Well, it's knowing our risk factors is number one. So, I mean, there's a website, doyouknowdiabetes.com, and it's like 8 questions and pretty simple 1-minute test. When I go on it, being active, I have a low risk, but if I'm inactive, I'm at high risk. If you're high risk, you need to get tested. I always ask my doctor, because of my family background, to make sure on my annual exams that I get a fasting test and an A1C test, and I always know my numbers. So the fasting test is a snippet of that morning's blood sugar, and the A1C test is a test that will give you a 90-day average of your blood sugar. So it will include fastings and postprandial after meal blood sugar. So you have a good average, and the doctor will know what those numbers mean and can talk you through what the best, whether it's just diet and exercise, which is an awesome treatment, or whether you need to go on some meds. But knowledge it will help you control this disease. It's not what medication you're on, it's how well you're controlled. So if you need to be on a little bit more medication to stay in control, not having those complications down the road and losing loved ones too early is the best thing we can do.
And are there any common signs or symptoms that you should look out for?
You know, unfortunately, diabetes is one of those things that you can go undiagnosed because there aren't a lot of real apparent symptoms. When you do start to get symptoms, it can be 10 years into the disease, and such as dry mouth, thirst, very, very thirsty. Your weight can either go up or down. There's a few symptoms that are, but on a whole, the best thing you can do is know your risk factors and be tested at every annual, if you're at higher risk, to be tested at every annual exam.
And do you have any additional information or tips you'd like to share with us, Wendy?
I think one of the most important tips is really just staying active. And I know I said it already, and eat healthy. It makes such a, you'll enjoy life more. The less you eat, the better you'll feel, the more active you can be. So we can enjoy life. And even if you do have diabetes, it's controllable disease. It's a controllable disease. So stay in control. It's the best thing you can do for yourself and your loved ones so that you don't have the complications.
And where can viewers go for more information?
DoYouKnowDiabetes.com is a great first start, and there's a lot of links on there. You can take the risk test there, and there's a lot of links there for other information.
Well, thank you so much, Wendy. I truly appreciate it. Have a great afternoon.
You too. Thanks for the time today.
Thank you.
Bye.
Bye-bye.